Hi, I'm Justin Seitz, and this is my dad, Jack Seitz. We own the Legacy Council. We are insurance and retirement advisors. In this quick video, we wanted to answer a question that we get asked a lot by our new to Medicare clients that are typically turning 65 and new to Medicare. The question, Dad, is what are the different parts to Medicare and what do those parts cover?
All right. Five parts: A, B, C, D, and E. Part A is the hospital coverage. Now, with that particular benefit run by the federal healthcare system, requires a deductible upon admission, and but your hospital facility charge will be covered by Part A. Part B, however, is for the medical service providers, your doctors, your surgeons. It also covers outpatient surgery, all the preventative exams, mammograms, colonoscopies, blood work. Now, the distinction with Part B is it only covers 80% of those expensive. What happens to the other 20%? That is your responsibility as the Medicare beneficiary, unless you have transferred that risk to, and I'm going to cover that in a moment, Part E, the Medicare supplement. What I've just described on A and B, I'm going to slow down a little bit here so this makes hopefully a little easier to understand. Those are the two benefits that are listed on your red, white, and blue Medicare card. So if we just have that card, we have an 80/20 plan. And that sounds good, but if I have to incur an expense of $1 million and I'm got to cover 20% of that, that's a hard check to write.
Mhm.
So I would use a Part E Medicare supplement to cover that cost. Now, what happens to C and D? I skipped that, didn't I? Part C is private insurance managing your federal health care benefits. By law, they have to cover everything. This is private insurance companies. By law, they must offer everything offered by Original Medicare, and often you will find that they will include benefits not covered by A and B. Many of them will offer dental, vision, hearing benefits. This is private insurance companies managing the federal health care system. And then finally, we have Part D, that is your drug benefit. Now, Original Medicare, you'll notice on your red, white, and blue card, there is no Part D listed. If you're going to stay on Original Medicare, you must purchase a standalone Part D drug plan unless you have other creditable coverage through other sources. Now, as hard as we work to try to make this all simple, sometimes even with that explanation, it can still be confusing.
Yeah, so that was a lot of information. That was a great answer, Dad. Thank you for answering that. If you have any questions while watching this video, if you're currently on Medicare or you're new to Medicare, feel free to reach out to us. We are always happy to help. Thanks for watching.